For those of you who don't know me, many I'm sure, so I'm Alan Hayward. I'm the Service Manager for the Youth Cancer Service for the South Australia and Northern Territory. And as Lee rightly said, this presentation is about adolescents and young adults and consumer engagement within our service. I would also like to acknowledge that some of the people in this video are actually viewing, or in this presentation are viewing today. Thank you, I can see you. And yeah, that's great that you've been able to come along today as well. So just a little bit of background for us, for who we are. I'm from the Youth Cancer Services. So we're part of a national network of youth cancer services in Australia, with some federal funding as well as state and territory funding. So we also get support here in South Australia from the Government of South Australia and also the Northern Territory Government. So we exist for 15 to 25-year-olds who are reasonably newly diagnosed with cancer. We provide a mobile service in metropolitan Adelaide with offices at the Royal Adelaide and the Women's and Children's Hospital. And we visit at about 12 different sites in Adelaide, so including public hospital cancer treatment sites and private as well. We also have a nurse coordinator up at the Royal Darwin Hospital who we work with as well. In terms of our numbers and reach, so there's probably around about 60 new diagnoses for SANNT per year in this age range, and the mix is about 25% paediatrics, 75% adult, and most of the patients we are working with are in the public health system, with a small amount of private and a small amount of those moving between the two. So some of the things that we help with, it's mostly supportive care. So trying to help with the timeliness of referral, getting access to expert care. So things like clinical trials, tumour streams for medical discussions. We run our own psychosocial medical multidisciplinary team meeting. We also help with case management, care navigation, and we have a bunch of staff that have expertise in various areas, which I'll show you next. We also provide some education and vocation support. Fertility preservation is really important for the cancer group, and having that access to that before treatment begins is really important. Sexual health is an important thing, but especially important with this age demographic. We have an exercise program that operates at various locations. We try to facilitate peer support. Financial assistance is provided where we can. We also try and help the transition from the paediatric to the adult services. We provide a lot of referral and resources out into the community. And we realise that we're interacting with the family, usually partner, children, parents, friends, siblings, realising that the young people we work with come as a package with all of those supports around them. We also provide some access to distraction equipment like PlayStation and DVDs, etc. And we also have a youth advisory group, which is pretty much the content of the talk today. So as I said, we're a multidisciplinary team. I just wanted to show you there's a bunch of us that work here, all from different disciplines, so medical, nursing, exercise physiology, music therapy, social work, psychology, and admin support as well. So yeah, a whole bunch, and all working, mostly working part-time, and as I said, across multiple sites as well. So that's pretty much about us. So thinking about some of the key elements of adolescent development. So this is a time of enormous change. So thinking about identity and establishing your own identity in the world, becoming more connected socially with your peers, but also the world around you. Sexuality and body image is very important, as well as future plans and goals. Also developing cognitive and emotional maturity, and also increasing autonomy and independence. So I would say that many of the elements of adolescent development here are really important things that we hope to lever off in the work that we're doing in this space. So we're talking about the Youth Cancer Service Youth Advisory Group. So this is a group that was started in mid-2010, so probably around about the same time that the Youth Cancer Service sort of developed into a higher gear, I guess, if you like, with a more sure funding stream. At that same time. So consumer input was considered a high priority then. That's reflected in some of our guiding documents. So the South Australian AYA, or Adolescent Young Adult Cancer Pathway, as well as the National Service Delivery Framework, which was developed up with Canteen Australia and Cancer Australia in the beginning of that period, and then more recently the Australian Youth Cancer Framework, which we've worked together with Canteen to pull together. And you can see there's a little slide there on the right, which shows young people at the beginning, at the centre of everything that we're doing, and also and that youth engagement is really important there too. So at that time, back then, that was like we were certainly supported by SA Health policies for consumer engagement, and that that continues today. And I'll show you some more on that a little bit later. So we had targeted different patients in this group for so diversity in age, diagnosis, where they were treated, like public, private, pediatric, adult, for example, and also thinking about some the time since treatment and into their survivorship, and also just different backgrounds as well. So trying to be representative of the young people that we're working with. So the young people were invited to participate. A terms of reference was established, and role descriptions and all that sort of thing. And we have meetings. They continue to this day. So we've got them about every second month at the moment, and they reported back to the Central Adelaide Local Health Network Cancer Exec, as well as Canteen Australia, who are the holders of some federal funds for the youth cancer services around the country. And we have reporting requirements back to them as well. So speaking of support and where consumer engagement comes in, so the National Safety and Quality Health Service Standards, Standard 2 is all about partnering with consumers. And also I just wanted to direct you to the Central Adelaide Local Health Network Framework, so Consumer Partnering and Community Engagement Framework. That's sort of been developed over the last couple of years, which our youth advisory group had some input into, and also there's a bunch of information there that helps support the work that we're doing here, and I guess to make this more embedded in the regular work that we do in the health services. So I just wanted to talk about some of the projects that we've been able to work on over the years. And this is these are pictures here from the old RA. So at that time we were able to develop 2 inpatient rooms and also a day chemotherapy room that were designed by young people. So an age appropriate layout and facilities within the room, but also the ability for friends and parents, etc., to be able to come and be with those young people. As I said, that our youth advisory group had a big input into that, and that was officially launched in January 2011. And we also have had a chance to help develop the Adolescent Lounge at the Women's and Children's Hospital. So, and some of the, so you can see there on the right, there's the mural on the wall, but a bunch of equipment and stuff that's in there that's specific for adolescents and young adults. All of that stuff was designed with young people's input, which was really valuable. The other thing that was interesting about the ward over there too was developing it so that the design throughout the whole ward was single side rooms, which is super important, privacy being very important for adolescents, but also being age neutral as well. So they didn't use Disney logos, for example, which is a common thing we hear from our adolescents and young adults about being in a paediatric setting. We also had an opportunity at the Royal Darwin Hospital to create a young adult lounge as part of one of the inpatient units up there as well, which was a great experience to have input into as well. So some of the other stuff that we've done, so SA Health have got some on their website, they've got some specific pages for youth cancer, and we've had really strong input from our young people into that. So you can see like the photos there, sort of helping to talk about the different types of experiences and things you might see, and also information that you might be interested in, that sort of thing as well. As part of that as well, so there was a fair amount of video content that went into that as well. Now, we had a test of this earlier, and unfortunately, it didn't play the sound for us. So I'm not going to try that again, but just going to leave it a short break because this will be included back into the video after today's presentation. But basically, this is another website, video that can be found on the website for SA Health, and this one is each of the young people introducing themselves and a little bit about themselves and why they wanted to be involved in this project.
As members of the Consumer Advisory Committee for the Youth Cancer Services, we've taken it upon ourselves to have discussions to answer the questions that you might have with your journey through cancer. We're happy to share our experiences because we've all been where you are now.
Hi, I'm Nicole. I'm 18 and I was diagnosed with a brain tumour when I was 16. I had my test done at Flinders and I was treated at the Women's and Children's.
Hi, I'm Ebony. I'm 16 years old and I was diagnosed with rhabdomyosarcoma last year when I was 15 years old, and I'm still in treatment now at the Women's and Children's Hospital.
I'm Dale. I'm 20 years old. I got diagnosed with acute lymphoblastic leukemia when I was 16. I've been treated at the Women's and Children's for 3.5 years.
Hi, my name's Sarah. I was diagnosed at 16 with a Ewing sarcoma. I had treatment at the Women's and Children's and then I relapsed and had treatment at the Calvary. I'm in remission now.
G'day, I'm Mark. I'm 20 years old. I had Hodgkin's lymphoma when I was 17. I was treated at Flinders Medical Centre.
I'm Susanna. I'm 21 and I was diagnosed with osteosarcoma, which is a kind of bone tumour, when I was 15. I was treated with chemotherapy at the Women's and Children's Hospital here in Adelaide.
I'm Matt. I'm 24, and when I was 19, I was diagnosed with acute myeloid leukemia and went on to have a matched unrelated donor bone marrow transplant here in Adelaide at the Royal Adelaide Hospital.
So moving on, I just wanted to highlight some other of the projects that we've worked on over the time. So we've had a strong commitment to inviting consumers to sit on our interview panels for the positions that we employ within the service, and that's probably only changed recently with COVID, but that's continued throughout the time. We've been able to invite people along to our youth advisory group to get consults from them on various things, brochures and fact sheets. So thinking about the language, the images that are in there, the content and all that sort of thing. Other health professionals have come to seek some input about what is important to young people. So nutrition and exercise are two of note that we've had health professionals come and seek advice about. Non-government organisations have also been invited and involved in the youth advisory group, thinking about getting feedback on what service they're providing and how that is being received from the users of those services. And we've also been able to put people forward for various media and newspaper articles. The one on the left there was something for Bandana Day that we highlighted in the last couple of years. And then the other one there, a great non-sensational headline there, but the Zombie March and utilising one of the young people for that campaign to help highlight the need for blood donation. So some other things have been producing videos. Transforming Health was a particular note there. We've also had connections to other consumer groups. So where we've been able to, we've nominated people for other groups. So there's an Aboriginal Torres Strait Islander youth cancer reference group with SAMRI, for example. We have had a Youth Cancer Service National Youth Advisory Group and have promoted people to participate in that as well. We've also have linkages with our other 5 jurisdictions, their local youth advisory groups, and as well as the promoted people to different more local things like the South Australian Cancer Clinical Network through the CEIH as well. Research opportunities. So we've had researchers come in and talk to our youth advisory group about the surveys that they would like to do, clinical trials they're undertaking, and some of the content of that, as well as being able to be fed back. Some of the photos there around the youth advisory group, an opportunity we had so a few years ago to go to the Teenage Cancer Trust conference in the United Kingdom, and being able to take a youth ambassador from Canteen and our service to that meeting as well, which was great. And but the photo on the left there is having young people participate in some research that was going on as well. So in terms of the research options, I think we've spoken about that, but also thinking about things like advocacy. There was a point in time a few years ago where Medicare numbers were up for discussion with the MSAC committee nationally. So we were able to help mobilise some support for Medicare numbers for fertility procedures, which is really important for young cancer patients as well. We've had the opportunity to invite young people to speak to different groups, so taking young people out where we can to our trainee doctors, trainee nurses, or cancer specialist training days and things like that, as well as some charity days. We've had the Chad Hancock Race Day as one, and also there was also a golf day that's been run through the research, like the Hospital Research Fund as well. And we've also presented case studies to professional groups with our young people having some input into the types of information that we're telling them about. We've also been involved more recently in some discussions around the new Women's and Children's Hospital, and also the Bragg Centre, which will be the proton therapy centre for Australasia. So having some input into the design for how that might look for young people has been really important. So Zoom meetings have become a way of life for our youth advisory group. So having to change the way we worked last year with COVID, that opened up some other opportunities for that group as well to host some peer support events that as an online sort of presence, which was quite helpful for some people, as in, it certainly breaks down barriers between people who are far away and have access issues to getting into the hospital and things like that. We've also partnered with an NGO like Canteen, for example, to start thinking about some more formal support, peer support training, and having our youth advisory group going through some, at their request actually, around some more formal information about providing that peer support to other young people. And we've also, they've also been advocating for some dedicated space at the Royal Adelaide Hospital for youth cancer as well, which will be good if we can see that eventuate. And the pictures there in that in this slide are some images of one of our young people who has co-hosted a couple of webinars that Julie McCrossan has put together for the Bragg Centre for Proton Therapy. So very pleased that that our young person there has been able to have that opportunity. So just almost winding up, thinking about things, why are young people getting involved in all these sort of things? And you can see the types of quotes there. I think maybe something that I would maybe not have realised sooner is that young people are very interested in giving back and wanting to think about the other people that are going through the same situation as them, and thinking about what they can do to either support them, but also to make it a better environment for the people coming behind them, which I think is really important to remember. So some of the benefits of the consumer engagement, I think that we've found, so having a fresh perspective is fantastic. Someone who is not within the health system or is embedded in the health system as we as workers are is fantastic to hear about. Obviously that lived experience and not having the same lens as we do as clinicians. The consumer voice also carries a lot of weight, and that's not to be underestimated. And I feel like some of the times when we've put ideas to our peers or executive, it's not as listened to as when it's a young person or a consumer, for that matter, who are putting their weight, their voice behind that as well. Our consumers really enjoy giving back to their peers, as we've seen in that slide just before. And also we've thought about this as being able to provide opportunities that young people might not have otherwise had access to. And I guess that's also another feature of young people and cancer, is that they often miss out on many of the events their peers are having at the same time that they're going through their cancer treatment, because they're unable to. So this is another way, or hopefully that they can get opportunities that they wouldn't normally get to have. Some of the challenges that that I think we've faced over the years have been things around like momentum, thinking about different, like what kind of projects we can bring to the youth advisory group. Sometimes the slowness of some of those processes, depending on what it is. The cogs of health or government sometimes turn quite slowly. But so trying to maintain that momentum has been really important. Recruitment to the committee is something that we struggle with from time to time, although I think we've got a good mix and a good number of people who are interested at the moment. So we're embedding ways that we can keep that succession planning happening as well as we go forward. Managing expectations, I think, is a really important thing, and thinking about the wonderful ideas that young people bring, and then also having to temper that with what's actually possible, and why something might not be able to go ahead as the group would like. Thinking about payment as well, so having a budget to do that. I think my comment there would be, I think I was, as the manager of the service, probably more worried about that in the very beginning of running this group. But I would say that the longer that's gone on, it's become more part of how we work and stuff like that. And I would say also the work that's happened, say, for example, at the Carlin level, in terms of consumer engagement, there's significantly more support for that, and that's sort of being devolved out now to the programs as well, to have some responsibility for that, which is excellent, I think. The other thing that we would always be aware of too is checking in with our young people as well. So for them hearing stories about others' experiences that maybe make them think of their own experience, or others that they've met along the way. And also ensuring that we're not asking too much of our young people in what we're doing with them as well. And also, making sure that they get to live their regular life, which is where they should be, and go on to as much as they possibly can as well. That was pretty much the end of the talk that I wanted to talk about. So just to acknowledge that our wonderful youth advisory group members and also our staff as well that we work with, and then you can see there's some of the other organisations that we also work with that have been really important to not only our service but also our youth advisory group over the years. So I guess the option or the opportunity is to maybe open this up, and if anyone would like to ask some questions, they'd be more than welcome.
Thanks, Alan. Katie Billing here. Sorry, I was running a few moments late, and thanks, Lee, for jumping in and getting us started. Alan, thank you. That's fantastic, and we're really grateful to you for presenting today and opening up our conversation around consumer engagement. What I might do is just close out the session, and then while people are thinking about the discussion and the questions they might like to ask, and then we'll sort of coordinate a question session after that if you like. So I'll just quickly, I guess, sum up from an overarching point of view, and hopefully I share my screen successfully. So really, for those of you that are joining us online, these sessions are held every Thursday at 1 o'clock. And obviously online whenever, if you missed a session, you can jump in and grab the video. But if you're here in person, you get to actually join in the conversation. So I'm really encouraging you to try and make that 1 o'clock time slot if you can. And really what we're trying to do is bring together healthcare teams from across the system and provide them with a space to explore what others have learned and share, really trying to keep it simple. And certainly if you have a story to share, a story that you'd like to share with others, and maybe you've succeeded in solving a problem, or maybe you haven't, maybe you've learned something whilst trying to solve a problem, or you'd like us to explore some themes that you think are really important, I'm more than happy to hear from you. So please do get in touch.